Hello, everyone. My name is Emily, and this is Debelina and Ashley. Today, we're going to be talking about occupational therapy's role in managing chronic pain under the guidance of Kendall Doherty and Dr. Sheila Longpre. In particular, our guiding research question was, are occupational therapy interventions effective in promoting engagement in activities of daily living in adolescents and young adults with chronic pain? Past research has established that chronic pain causes occupational loss, and obviously activities of daily living falls within this loss. For the purpose of this critical literature review, we defined chronic pain as pain that persists over 3 months despite medical treatment or intervention. There is no single effective way of treating chronic pain, so multidisciplinary interventions are often used to combat limitations and deficits associated with chronic pain. Occupational therapy interventions, which aim to increase performance, engagement, and self-efficacy in activities of daily living, are not well documented in literature. However, as OTs are frequently involved in these multidisciplinary teams, our study aimed to investigate current research on these interventions, as well as the gaps in research, which isolates OT. For our CLR, we selected 8 applicable peer-reviewed articles using search terms including activities of daily living, adolescence, occupational therapy, chronic pain, and pain management, amongst others. Our selected articles were all published within the last 10 years.
So in addressing the question, are occupational therapy interventions effective in promoting engagement in ADLs among adolescents and young adults with chronic pain, we are able to identify evidence to support occupational therapy's role in chronic pain management through our data collection. The examination of the 8 articles provided us with qualitative evidence to support 2 themes within the literature related to the guiding question. The first theme we identified in 7 out of 8 articles was when working to address chronic pain in children and across the lifespan, occupational therapists have a role among multidisciplinary teams in planning interventions and treatment for the clients. The second theme that was identified is chronic pain negatively impacts one's ability to engage in daily life, including activities of daily living. And in 4 of the 8 articles, it was noted that chronic pain has a significant impact on an individual's ability to participate and engage in their activities of daily living, but interventions from an occupational therapist among with other professionals can reduce these impacts. Some of the limitations of this critical literature review for the current scope is that the analysis was based on limited numbers of articles. In the 8 articles that we reviewed, we could not find a single article that isolates the role of occupational therapy exclusively in managing chronic pain, as all the studies concerning occupational therapy and chronic pain were part of multi-structure rehabilitation program. In the studies itself, we identified several limitations such as smaller sample size was used in majority of those studies, which can prevent generalizability and lack of randomized control trials, resulting in potential researcher bias. Another aspect that current studies have not been able to establish is a baseline for the intervention, which is also a significant limitation.
We also came up with some suggestions for future research. First, isolating OT interventions on ADLs in patients with chronic pain. Second, we noted that there's a need for curricula covering pediatric pain management as the information is often generalized. Additionally, while general pain management is often covered in occupational therapy education, there is a need for a more evidence-based and structured approach to deliver effective intervention among the pediatric and adolescent population suffering from chronic pain. Some of the clinical implications that we found were that it is difficult to have a generalized treatment plan for all patients due to the diversity among patients with chronic pain. We also noted that nearly every study agreed that occupational therapy interventions improve a patient's mental well-being and empowers them to change and improve their lifestyle. Additionally, we noted OT's significance in a multidisciplinary team at providing activity-based interventions which promote the client's ability to participate and engage in meaningful occupations. Key factors like proficiency in performing activities affects self-efficacy and builds confidence in performing necessary occupational function. Additionally, social support for patients suffering from chronic pain provides motivation for patients. To summarize, occupational therapy benefits occupational performance, including ADLs, when included on a multidisciplinary team for treating chronic pain. There is, however, a need for further research to address the gap in literature isolating the specific effects of occupational therapy on chronic pain in adolescents and young adults in order to fully understand the clinical significance. Thank you for listening.